Welcome to today's webinar entitled Non-Medical Counseling. We are thrilled to have Lisa Madison with us today. Lisa Madison is a counseling program analyst with the Military Community Outreach Office in the Department of Defense. She graduated from Appalachian State University with a Bachelor of Social Work degree and received her Master's of Social Work degree from St. Louis University. Ms. Madison has lifelong experience with military service, first as a child in a military family, and then as a military spouse. Her experience in social work has centered on quality of life issues that impact families, with special focus on the military family. Without further delay, I'll turn things over to Lisa.
Thanks, Stan. Good afternoon, everyone. Again, my name is Lisa Madison, and I will be the presenter for the webinar this afternoon. Before we begin, I first want to thank everyone for attending today and taking time out of your busy schedules. We hope that this presentation is informative and something that you can use in your ongoing work with military families and service members. I would also like to take this time to introduce Jenna Moore, who is a Senior Program Manager in our office and is also online today. We both welcome any questions you may have regarding this presentation or about the programs. If the questions are more specific or particular to a situation, we can discuss those offline after the presentation. I will be providing my email at the end as a point of contact, and once again, we are happy to answer any questions you may have, even in the future. Okay. Sorry about that. Skip on. Okay, the intent of this webinar today is to provide an overview of non-medical counseling, which is offered through Military OneSource and the Military Family Life Counseling programs, as well as to inform you on how to access these means of support. During this presentation, I will be referring to Military OneSource as MOS and Military Family Life Counselors as MFLACs, respectively. It's just easier to say. One thing I'd like you to remember with the various options presented today is that although MOS and MFLAC non-medical counseling is delivered in different venues, as will be noted and described further in this presentation, the scope of the counseling is identical. Okay. One of the biggest questions that we found people have is, what is non-medical counseling and where did it come from? Well, I'm going to give you a brief background and then explain the instruction that you see in front of you. In response to the need for increased support for the active force and the Guard and Reserve, DoD established non-medical counseling, short-term focused counseling service to address issues that occur across the military lifestyle and help service members and their families cope with normal reactions to the stressful events caused by repeated deployments, war, and reintegration. The instruction you see above establishes the policy whereby service members and their families may seek private and confidential counseling. As referenced in the DoD, the overall goal was and is to augment existing military counseling services and eliminate the negative stigma associated with seeking counseling support and barriers into accessing those support systems. For anyone that today that has any more questions related to this instruction, we would please ask that you refer to the DoD, and then from there, if you have any additional questions, please feel free to contact us at any time. Okay. This is a brief description on what non-medical counseling actually is. Non-medical counseling is designed to provide short-term solution-focused, goal-oriented counseling for issues that can be effectively addressed within 12 sessions per year. Such issues as communication issues, adjustment to situational stressors, stress management, decision-making, grief, even such things as blended family issues and parenting skills issues. The resource and the support is available for up to 12 sessions per issue, per eligible family member. So several members can access this support. This means that someone could receive also 12 sessions for one issue, perhaps something like adjusting to a deployment alone, and then once those sessions are completed, 12 more sessions for couples communication issues that may be experienced when the service member returns from deployment. Above on the slide, you will see additional examples of the types of issues that non-medical counseling can address. And I would also like to point out that non-medical counseling through both the programs is available at no cost to all eligible members. Okay. The individuals providing non-medical counseling have at least a master's degree and are licensed within their particular state or territory to practice at the independent practitioner level and have undergone a background check. This is the same background check as those delivering mental health services in our military treatment facilities and family centers. The support provided is available to active force, Guard and Reserve service members, and their families. And the contacts, whether by telephone, internet, or face-to-face counseling, are kept private. Personal information is secure, and each user is treated confidentially. For example, the service member as well as service member's commander is not advised when a family member calls or conducts an online visit or face-to-face session. There are exceptions, however. Counselors have a duty and are mandated to report the following: suspected family maltreatment, this includes domestic violence, child or elder abuse or neglect, and threats of harm to self or others. These reports will be made to the appropriate military and civilian authorities. Okay. To help further clarify what non-medical counseling is and the types of issues it can address and support, I believe it's also helpful to clarify and point out what it is not and what it cannot support. Non-medical counseling is not designed for issues requiring long-term support. As such, it's not appropriate for diagnosed drug, alcohol, and other addictions, diagnosed mental health conditions that require medical treatment, such as post-traumatic stress disorder, depression, bipolar disorder, etc., and other behavioral health conditions related to trauma. Here's an example, or for an example, if a service member states that they have suicidal thoughts but adds that they would never do that to themselves or their family, then non-medical counseling would not be an option due to suicidal ideation. In these situations, long-term care is more appropriate, and those individuals are referred, of course, with a warm handoff to a military treatment facility and or TRICARE for services, and if appropriate, community resources with their personal insurance. Non-medical counseling does not provide or determine any medical diagnosis, nor will the counselor provide psychological or fitness for duty evaluations. Non-medical counseling is not appropriate as part of a patient's medical treatment facility discharge plan, nor is it available for anyone who is already under the care of another counseling provider. It is not appropriate for anyone who has an open case with the Family Advocacy Program, a victim advocate, sexual assault response coordinator, or child protective services. This includes if a duty to warn or mandated report is indicated. So I just wanted to clarify what it is not in case there's any confusion as to when someone were to request counseling support. Hopefully this clarifies it a little bit further. Individuals seeking non-medical counseling support may select from several different options. Once again, it's important to note that although non-medical counseling can be delivered in different formats, the scope of the counseling is identical, the overall scope. It's a great benefit having multiple options for counseling support, and one that you can select the method that best meets individual needs and time requirements for some people. Additionally, each option meets different generational preferences. For example, the younger generation is often comfortable in virtual social networking atmospheres and may prefer the online option, while a baby boomer or someone from the baby boomer generation may be more comfortable talking face-to-face. It's just there are multiple options out there. This counseling, the face-to-face option, this option is offered through both Military OneSource and the MFLAC program, albeit through different avenues. Military OneSource delivers counseling support through local providers off of the installation in the participant's local community, and this is using a traditional 50-minute counseling session. MFLAC counseling is delivered in person using multiple service delivery venues, including off and on installation at family centers on the installation, throughout the community, and often in DODEA or military-related schools and CDCs. The duration of this counseling sessions vary greatly depending on the needs of the participant. With both the MOS face-to-face and the MFLAC face-to-face options, each initial contact begins with a brief assessment, whether by the MOS triage consultant or MFLAC. This is to determine if non-medical counseling is appropriate for the person seeking support. And once again, if it is determined it is not, they are, with a warm handoff, referred to the appropriate support system. This option, telephonic option, is available through Military OneSource and was added to increase access to support and to provide an option for those who are unable to attend in-person counseling sessions due to their overseas location or other circumstances. Telephonic counseling sessions are conducted with an MOS counselor and, like the face-to-face option, begin with a brief assessment. Because this method of counseling is provided over the phone, it is not appropriate for complex issues or situations that require a group setting, such as couples or family counseling. Additionally, it is not appropriate for children under the age of 18. Once again, this option is like face-to-face options and has a limit of 12 sessions per issue. Okay, the online option. Online counseling is offered through Military OneSource and is great for those who prefer communicating online versus face-to-face or telephonically. This option uses an instant messaging format with the consultant and the participant communicating online in real time. Sessions can begin once the online counseling request form is completed and, like the other non-medical counseling options, is assessed for appropriateness. The first session is then scheduled and is each subsequent sessions, as they're not available on demand. Online sessions are available to those located anywhere. However, they can be impacted by such things as technical issues, connectivity, or low bandwidth. So it's something to definitely explore and see that if it works for the person. Because the counseling is conducted on a computer, it again is not appropriate for children under 18 or couples or family counseling. That includes marriage counseling. This option is one that is available worldwide using a computer that has internet connection. So it's pretty broad. Now I would like to go in and kind of briefly provide a snapshot of how to access those support options. As you see on the screen, this is a screenshot of the home page for Military OneSource. And at times, the columns and the pictures in the middle are different, but the left and the right columns remain the same. From the home page, which is this, you will see the 800 number in the white left-hand column at the top, which will take you directly to an MOS triage consultant, or the one calling, who can get you started in accessing all of the 3 forms offered through Military OneSource. You will also see links down the side of the screen, and there are 2 kind of on this snapshot. A little further down under more counseling options, telephonic and online. These allow quick access to each of the counseling options that are available through Military OneSource. I also wanted to point out this, I don't know how many people this applies to, but it's important. Under that 1-800 number, there is an international calling options link for those who are OCONUS. They would click on that link, and it would provide them further information on how to connect with a triage consultant to discuss counseling options. Another important thing to point out is one must register and log in to Military OneSource to access this support. that is important to convey to the, the family members. If calling a consultant, the consultant will verify the eligibility of the person calling for services, and if necessary, help the register the caller. From here, from the home page, once you access the counseling options page, you will have clear instructions, or one will have clear instructions on how to get started in each of the 3 non-medical counseling options. And you'll see that here. As you see towards the bottom of the screen, we couldn't capture it all. We were just trying to give you kind of a base to operate from, a reference point. But as you can see, the 3 columns, face-to-face counseling, telephone consultation, online consultation. If you scroll down further, it gives you very descriptive information on how to access each form of counseling. If you have received authorization, or if you have received authorization for online sessions, you will come back to this counseling page each time to log into each of your sessions. You can't see it on this page, and I apologize, but further down there are 2 boxes, and one of the boxes is log into your session for online counseling. So each time an individual, once they have completed the initial assessment process and scheduled their appointments, they would then go back to this page and click on the login link to start their session. It's a lot of information at once, but hopefully it gives you a snapshot and a reference point. This is kind of just a layout of the different ways that you can contact Military OneSource to ask questions or inquire further about the counseling options. And now this is the slide in terms of accessing non-medical counseling through MFLAC support. MFLACs are assigned to installations on rotational assignments. They can be contacted through the Installation Family Center POC. And the family centers throughout the services are, for example, ACS, MCCS, some fleet and family support centers, and airmen and family readiness centers. MFLACs are also on full-time assignments to support National Guard and Reserve components through Joint Family Support Assistance Programs, which are in all 50 states, 4 territories, and the District of Columbia. Some further support included on the bullets above are on-demand support for up to 3 days for the National Guard and Reserve components to support pre-deployment, post-deployment, and reintegration events for service members and their families. This is considered on-demand support. So people wanting an MFLAC to provide counseling at these events would access this through the on-demand system. And I can provide that link if need be at the end of this counseling webinar. Okay. I hope I didn't rush through this too quickly. At this point, we welcome any questions for that anyone may have and provide additional information.
At this time, you guys can ask questions through the webinar platform. So far, no questions have come in as of yet.
Well, let me also, while we're waiting, if anybody's thinking of one, because I hope that the information was informative, but let me give my email, and please feel free at any time if you have additional questions or one pops up during day-to-day operation, please feel free to contact me at any time. It is like my name on the initial slide. It's lisa.madsen, M-A-D-S-E-N, at osd.mil. And just please feel free to email me, and we will be happy to help you.
Lisa, one question did come in. Does MOS refer to the MFLAC program?
Jenna? It depends on the situation. They can refer to the MFLAC program if that's a more appropriate venue for the participant in general, like they are on installation or things such as that.
Okay. let's see. If counseling starts in December, does the service member family member still get 12 sessions?
Yes. Yes. It is 12 sessions. It does not go by, fiscal calendar year or whatever. They're 12 sessions per issue. And then if another issue arises, then that's you go back to 12 sessions per issue. So yes.
Okay, let's see. Since MOS is not for crisis counseling, if you receive someone who is in crisis, do you refer them to someone else?
Yes, we do. Well, first is that, the situation is assessed, but then, yes, and it's by a warm handoff. I'm not, certain if everyone is familiar with that term, but they are definitely, walked through the process and referred to the appropriate resource. They would not be, just left.
Okay.
Their own devices.
Are children covered as well, and do parents need to be notified?
Parents, okay, that depends on the venue. Children are covered to a certain point, and with these options that I presented earlier, face-to-face is an option, however, not the telephonic or the online. And then when I mentioned before in some of the schools or CDCs or summer programs, the parents are informed about the MFLAC and their role and what it comprises, and then sign any kind of consent form. So yes.
How do you find out who your MFLAC is for your unit?
For your unit or your installation, sometimes not all units are assigned an MFLAC. If you are an installation, like I mentioned before, one of the first places to try and reach out is at the family center. Each family center has a POC, a person of contact or point of contact, and they are the ones who can kind of facilitate the contact with the MFLAC on the installation. For populations of garden reserve or those that are geographically dispersed, the GIFSAP teams, which I pointed out earlier, Joint Family Support Assistance Programs, are often located at the Joint Family Headquarters in that particular state. Often you can, if you have a particular question about an individual state or territory, you can either, I'd say, Google it. They can be found that way, or you can contact one of us or your National Guard, and they can provide that information. But it's usually through the SFPD, and then it kind of goes down.
Are you guaranteed the same counselor after the initial 12 sessions if a new issue comes up later?
You are guaranteed the same counselor for the initial 12 sessions. Anything beyond that, I can't specify. For those MFLACs that are on rotation, they're on a rotational assignment for, a period of time. So that would depend if those issues are all kind of captured within that time frame of that rotational assignment. Then I would assume yes. But you are at least assured of the same counselor for those 12 sessions, and then, if possible, to connect with that same counselor for additional sessions. That is not guaranteed.
Are there any age restrictions?
Well, there are to a point. I would be happy to answer that one offline in reference to how young you are talking about or how old you are talking about. Once again, family members, children, this does not apply to extended family per se. It's just the service member and the family member. So any particular question on age requirements, please email me and say, okay, this is what I was thinking, or, for example, I will be happy to email you right back.
Okay, this is, I guess, a very similar question to the age restriction one. What are the rules on a child speaking to a counselor on their own?
Well, it once again has to be, it's only in the face-to-face format, and it has to be, the parent is notified with consent.
Okay. If a member was treated for PTSD last year, and no longer being treated, can he meet with a MOS counselor for a different issue?
That's the difficulty, is he was diagnosed with PTSD. He would have to be no longer diagnosed as that. So that's a kind of complicated question. I would assume, I would be happy to answer that one offline, and if you could please provide your contact information, I would love to provide information on that further. But once diagnosed with something, sometimes the diagnosis is there, and if he is still receiving care, then no, he would be referred to another service provider.
What happens if you ETS while in the initial 12 sessions?
ETS. There are so many acronyms out there.
I know, I'm not sure what
I'm going to guess that is like you transition somewhere else. Then you would pick up with another service provider in the location that you were transferring to. And if I am not understanding that question correctly, please clarify or once again email me, and I will be happy to provide further information. Because I know that that is an issue a lot of military families face, is the moving around and, trying to stay consistent and take care of things before you move again.
Okay. If while in sessions for relationship issues, a member gets diagnosed by his doctor as having depression, can he finish his sessions?
No. They will be, they can no longer provide, that counseling to somebody who is under the, supervision of another provider. The counselor would work with the couple on the best way to warm handoff and for the person seeking treatment for depression, and then possibly with, speak with the spouse as to, whether it's appropriate or whether they wish to continue.
Okay, we got several audience members who have commented on the ETS.
Yes.
Someone has said separate from the military. ETS means getting out of the service.
Okay.
ETS means they are in transition to get out of the Army.
Okay. There is a period of time, is my understanding, and I will be happy once again to provide particular information to your circumstance. But there is a period of time that they are eligible for service 180 days post-separation. My recommendation is, if possible, to get it started sooner than later so that you have so many other things going on at that point with separation that, if possible, to conclude that before you separate.
Okay, next question. If a soldier or family prefers to use face-to-face counseling after already starting online counseling, can they be redirected to a face-to-face counselor? And will their 12 sessions be cut short?
I will need to get back with you on that because I am not sure. I would assume that, the 12 sessions could be continued. However, I need to get back with you further. So if you could provide me that, your additional information or contact information, I can respond to you as soon as possible. Because that's a really good question. You find that one's not working for you, you would rather explore the other one, but you don't want to start over. So if that person would please provide me their contact information, I will be happy to respond.
Okay, that seems like to be all the questions that have come in.
Okay. Well, once again, those were great questions, and if any of those you want further information I did not answer, to your acceptance, please contact me, and I will be happy to answer your questions and provide you further information to your particular circumstance. And if any one of you who work with family members or service members have a question that comes up down the road, please keep my contact information and email me, and we will be happy to at least guide you to the right place, because it can be confusing at times, so we're always happy to help.
Well, thank you, Lisa, for your invaluable experience and expertise. I want to thank everyone for participating in today's webinar. If you didn't get a chance to submit a question before or during the webinar, you can still do so by emailing Lisa at the email address that she provided, or you can email your questions to moswebinars@militaryonesource.com, and we will forward your questions over to her so that she can respond to you directly.
And thank you, everyone, for all you do, and it's a pleasure.
Thank you again, Lisa. This concludes today's webinar.
All right. Thank you.